Do you know the different types of heart diseases and how to recognize them? Heart diseases, a diverse group of conditions affecting the heart and blood vessels, are something we should all be aware of. They're not just a concern for medical professionals, but for everyone. Why? Because heart diseases are the leading cause of death worldwide, affecting people of all ages and backgrounds. Understanding heart diseases is crucial, as it helps us recognize the warning signs early on, leading to prompt and effective treatment. It also helps us make lifestyle choices that can prevent or manage these conditions. From coronary artery disease, often linked with unhealthy lifestyle choices, to congenital heart disease, a condition you are born with, the spectrum of heart diseases is broad and varied. Knowledge is power, and in this case, it can be life-saving. Today, we delve into the various types of heart diseases, their symptoms, and treatments. Coronary artery disease is a leading type of heart disease worldwide, but what exactly is it? Well, let's delve into the heart of the matter. Coronary artery disease, or CAD, occurs when the blood vessels that supply blood to your heart muscle, the coronary arteries, become narrowed or blocked. This blockage typically results from a buildup of fatty deposits or plaques in the arteries, a condition known as atherosclerosis. When your heart muscle doesn't get enough blood and oxygen, you may experience symptoms like chest pain, shortness of breath, and fatigue. Sometimes you may not experience any symptoms until the disease has advanced significantly. This silent progression makes regular checkups and awareness crucial. Now, let's talk about treatments. The primary goal is to manage symptoms, slow the progression of the disease, and reduce the risk of heart attacks. This can be done through lifestyle modifications, such as adopting a heart-healthy diet, regular exercise, quitting smoking, and managing stress. Medications are often prescribed to lower cholesterol levels, reduce blood pressure, and prevent blood clots. In severe cases, procedures like angioplasty and bypass surgery might be necessary to restore blood flow to the heart. So, in a nutshell, coronary artery disease is a serious condition that requires attention and management. But remember, prevention is better than cure. Regular physical activity and a balanced diet can go a long way in keeping your heart healthy. Understanding coronary artery disease can help you recognize the early signs and seek treatment promptly. Another common type of heart disease is heart failure, but it's not as dire as it sounds. Now let's get one thing clear from the get-go. Heart failure doesn't mean the heart suddenly stops working. Rather, it refers to a condition where the heart isn't pumping blood as well as it should. Imagine your heart as a pump, a rather sophisticated one that keeps your body running smoothly. In heart failure, this pump is not as efficient as it needs to be. This inefficiency can occur due to several reasons. It may be a result of damage from a heart attack, high blood pressure, or even diseases that damage the heart's muscle tissue. Now, how do you know if your heart is failing? Well, the symptoms can be somewhat subtle. You might experience breathlessness, fatigue, swollen legs, and a rapid heart rate. Sometimes you might even feel a persistent cough or wheezing. Knowing these symptoms can make a world of difference because heart failure is a progressive condition. It doesn't get better on its own, but it can be managed. Treatment typically involves lifestyle changes, medication, and in severe cases, surgery or devices to help the heart function better. Remember, your heart is the engine of your body. It deserves the best care you can give it. Recognizing the symptoms of heart failure is crucial to managing the condition and improving quality of life. Ever heard of a heart disease called arrhythmia? It's more common than you might think. Arrhythmia isn't a single condition, but rather a collection of conditions. The term refers to irregularities in heart rhythm, when your heart beats too fast, too slow, or with an irregular pattern. Now, you might be wondering, what causes this? Well, arrhythmias can be caused by a number of factors including heart disease, stress, smoking, heavy alcohol use, certain medications, and even caffeine. So, how does one know they have an arrhythmia? Symptoms can range from barely noticeable to life-threatening. They may include palpitations, a feeling of a racing heart, a slow heartbeat, chest pain, shortness of breath, dizziness, sweating, and fainting. However, some people with arrhythmia have no symptoms at all. Treatment for arrhythmia is highly dependent on the type and severity of the condition. Some arrhythmias may require no treatment at all, while others might necessitate medication, lifestyle changes, or even surgical procedures. For example, a pacemaker might be implanted to help control abnormal heart rhythms, or a procedure called cardioversion might be used to restore a normal rhythm. Remember, if you or someone around you experiences severe symptoms of arrhythmia, it's crucial to seek immediate medical attention. Knowing about arrhythmia can help you understand why maintaining a regular heart rhythm is important. Valvular heart disease may not be as well known, but it's a type of heart disease that deserves our attention. Valvular heart disease is a condition characterized by damage to or a defect in one of the four heart valves: the mitral, aortic, tricuspid, or pulmonary. These valves have flaps that open and close with each heartbeat, ensuring blood flows in the right direction. When they malfunction, it can have serious implications on our health. A variety of factors can cause valvular heart disease. It can be congenital, meaning you're born with it, or it can develop due to other conditions like rheumatic fever or infections. Aging also plays a significant role, as it can lead to wear and tear on the heart valves. Symptoms of valvular heart disease might not always be apparent, making it a silent threat. They can range from fatigue and shortness of breath to heart palpitations and chest pain. In severe cases, it could lead to heart failure. Treatments for valvular heart disease vary depending on the severity and the specific valve affected. Medications can help manage symptoms and slow down the progression of the disease. In some cases, surgery might be necessary to repair or replace the damaged valve. With knowledge about valvular heart disease, you can be proactive in seeking help if you or a loved one experience any symptoms. Congenital heart disease is a type of heart disease that begins before birth. It's not a single condition, but rather a complex group of defects that occur due to abnormal development of the heart during pregnancy. These irregularities can alter the normal flow of blood through the heart, posing challenges to the body's ability to circulate oxygen and nutrients effectively. The causes of congenital heart disease are multifaceted. Genetics can play a significant role, as can certain environmental